Hello, I'm going to call this meeting to order of the Committee of Health and Human Services. If we can call roll.
Senator Lang. Here. Senator Wynn. Here. Senator Titus. Here. Senator Stone. Here. Chair Donate.
And if we can mark Chair Donate present when he arrives. I know he is in another meeting, and we are just going to hopefully start this process on these hearings so we don't have to have you guys all waiting around. We're going to go a little bit out of order, and we're going to start with Assembly Bill 215. So at this time, I would open the hearing on Assembly Bill 215. And welcome to the table, Assemblywoman Gorlow. And please begin when you're ready.
Good afternoon, Madam Vice Chair and members of the Health and Human Service Committee. I am Assemblywoman Michelle Gorlow, represent Assembly District 35, and we're going to be really quick today. We're here on Assembly Bill 215, which revises residency requirements for appointment to the Nevada Silver-Haired Legislative Forum, and I'll walk you through the bill. We changed 3-year residency to 1-year residency. There you go. Here with me is Fran Alvarez, and she's going to explain to you why this change is needed.
Good afternoon, Vice Chair, members of the committee. My name is Fran Alvarez, and I am the president of the Nevada Silver-Haired Legislative Forum. I am proud to serve as the president of the Nevada Silver-Haired Legislative Forum, representing Senate District 10 as a forum member. I am pleased to present Assembly Bill 215, which revises the residency requirements for an individual to be appointed by a senator to the forum. I provided an overview of the forum in February when I presented Senate Bill 45, the forum's bill. As a quick reminder, the forum has been created to identify and act upon issues of importance to aging persons. Members of the forum are seniors from each of Nevada's Senate districts, nominated by you and other senators for appointment by the Legislative Commission. Pursuant to Nevada Revised Statutes 427A.340, a person must meet 3 qualification requirements to be eligible for the appointment to the forum. First, the person must be a state resident for 5 years immediately before their appointment. Second, he or she must be registered voter in his respective Senate district for 3 years, immediately prior to the appointment. Third, he or she must be at least 60 years of age on the day they are appointed. Assembly 215 is a short bill. It revises the residency requirements for a person to be eligible for appointment to the forum by decreasing from 3 years to 1 year at the time a person is required to have a registered voter in a Senate district of the senator who nominates the person. Making this change opens greater prospects for well-qualified seniors to be appointed to the forum, yet still provides sufficient time to get to know their state senator, Senate district, and the challenges and opportunities that await them. I think you have a paper that tells you who the appointees are, what district they are in, and which ones, because of redistricting, they're no longer in the district they were appointed for. So this bill changes the 3 years to 1 year, and by the time we meet, our next meeting, everyone will have lived in their district for 1 year. The 3-year requirement is obsolete because of redistricting for many of our members. Thank you for your time and consideration of this measure. I'm available to respond to any questions from the committee at this time. Thank you.
Thank you. I think we have a question from Senator Titus.
So thank you for this. Just for clarification, so the list that we see here, from what I see, if everybody gets to nominate from each district, you should have 17 members, but you have 5. Or are these just the ones who were drawn out of where they currently live, the list that you gave us? You should have 17 members if each senator gets to appoint a member. Is that correct?
Fran Alvarez for the record. We should have 21. Some of the
Oh, I'm sorry,
districts
21,
at this point do not have someone representing their district. And
Okay.
Senator Titus, your district is one of them, so I was going to come talk to you about that.
Okay.
But because of redistricting, you can see on that paper, like, I was appointed by Senator Donate in District 10. Because of redistricting, I think I'm now in 21, which is Senator Orenshaw. So that's what that paper shows, how many of us could not possibly live for 3 years in that district.
But what would happen to the folks that, who did he appoint in Senate District 21? Would they be displaced then?
When they're, I think in October of this year, everyone's tenure
Okay,
is.
so this bill won't take effect until, it says the bill takes effect upon passage. So that's my, I mean, I appreciate what you're doing, and I have no issue with the changing it from 1 year, from the 3 year to 1 year. And I was thinking every county got one person versus every Senate district. But, so every Senate district gets one person, no problem with that. No problem. And, they have to at least live in Nevada for 5 years, even if they've moved around. That's fine. In one district for a year is fine. But again, how if it's effective upon passage, when folks' terms, so what's the average term when you're appointed? Is it just a 2-year term, or, because it doesn't say anything in the bill about it?
For the record, Fran Alvarez, yes, Senator, it is a 2-year term. And in those districts which are affected as the person who is there is termed, if they want to be reappointed, they can. But if the senator who has that district has someone else in mind, then he can appoint someone else because it's only the 1-year residency.
Okay, and so, and this bill's only gonna, even though it starts right away when we, at time of passage, if the governor, say, signs it, it doesn't matter really, because the terms aren't expiring, it will have no effect on the people currently in their terms. Just the next round of appointments, there'll be a different makeup to it.
Fran Alvarez for the record, yes, Senator, that's
All right,
correct.
That's where I'm getting at. Thank you.
Do we have any other questions from committee members? Okay. So at that time, I will begin testimony in support of AB 215. So if I can have you guys, do you
I'm
have some
sorry,
further
just
questions?
real quick, I've got my own committee to run too, so if you don't mind, I'm going to say
That
goodbye.
is
and-
totally fine.
Okay,
Thank you.
Thank you.
So if you were here in support, please come up to the table either in Las Vegas or here in Carson City. Seeing no one coming to the table, both here in Carson City and in Las Vegas, if we can go to the telephone lines, broadcast services.
Thank you, Chair. There are no callers at this time.
And next, if we can go to testimony in opposition. Is there anyone in the room or in Las Vegas on opposition? Seeing none, is there anyone virtually to testify in opposition?
Chair, there are no callers choosing to testify at this time.
Thank you. Anyone in neutral? Is there anyone in neutral? Seeing no one here and no one in Las Vegas, anyone on the lines in neutral?
Thank you, Chair. There are no callers choosing to testify at this time.
Thank you. So at this time, I will close the bill hearing on Assembly Bill 215. And hold on one second. I'm going to figure out which one to open next. Who is here for, is there anyone here for 136? No? Yeah. $24? Yeah, here we go. I will now open the hearing on Assembly Bill 24. And I see people have already made their way to the table. So I will go ahead and begin when you're ready.
Thank you very much, Chair Wynn and committee members. My name is Cody Finney, and I serve as the Deputy Administrator of the Division of Public and Behavioral Health Planning and Regulatory Section. And I really appreciate the opportunity to be here today to share with you Assembly Bill 24. The purpose of this bill is to improve the representation of local emergency response programs on the EMS Services Advisory Committee. Some tribes in the state run their own emergency medical systems. Last year, I visited some of those leaders, and it was clear that communication between them and the state EMS program could be improved. This program has a particularly active advisory committee, and adding tribal representation would formalize the communication in a way that's beneficial to the program and the regulated communities and the tribes that run their own EMS services. As the bill made its way through the Assembly, we received a request to amend it to include one member who is employed by or serves as a volunteer with a local governmental agency that provides emergency medical services, but which is not part of a firefighting agency or law enforcement agency. That was added in an amendment to the bill, and we agree that that would also improve representation. I really appreciate the opportunity to be here today and would be happy to answer any questions you have about this one.
So I'm looking around. I know that moved pretty quickly. Do we have any questions from the committee members? No, it seems very straightforward. So I appreciate your presentation. At this time, we will move to testimony in support of Assembly Bill 24. I'd remind everyone to please state your name clearly for the record and spell your name for our committee staff. I know I'm really terrible about remembering to remind everyone that, so if you could do that, and please limit your testimony to 2 minutes and begin when you're ready.
Good afternoon, Vice Chair, members of the committee. My name is Jennifer Lanahan, Jennifer Lanahan, and I'm here on behalf of the Las Vegas Paiute Tribe and the Reno Sparks Indian Colony. And we want to thank the bill sponsor, and we urge your support. Thank you.
Thank you. Alex Tanchek, Alextanchek with Silver State Government Relations, here today representing the Pyramid Lake Paiute Tribe, Duckwater Shoshone Tribe of the Duckwater Reservation, and the Shoshone Paiute Tribes of the Duck Valley Indian Reservation, also here in support of the bill. And thank you to the division for bringing it, and thank you to the committee for hearing it.
Seeing no one else coming to the table here in Carson City, do we have anyone that would like to testify in support in Las Vegas? I see some people in the room, but not coming to the table. So broadcast services, do we have anyone on the line to testify in support?
If you would like to testify in support of AB 24, please press *9 or raise hand within Zoom to take your place in the queue. Chris, you are unmuted and may begin when ready.
Hello, my name is Chris McCann, EMS Chief with Elko County Ambulance Service in Elko, Nevada. I just wanted to vocalize my support for AB 24. The amendment that was adopted in the Assembly allows an opportunity for Elko County Ambulance and other third service agencies to be part of this committee. We've never had that opportunity before, so I'm excited to voice my support for this bill.
Do we have any other callers in
Chair,
support?
there's no addition.
Sorry.
I apologize, Chair. Not at this time.
Okay, wonderful. We'll go to testimony in opposition of Assembly Bill 24. I don't see anyone here in Carson City or Las Vegas. Is there anyone on the line in opposition?
If you would like to testify in opposition to AB 24, please press *9 or raise hand in Zoom to take your place in the queue. There's no testimony at this time, Chair.
Thank you. Neutral. Is there anyone to testify in neutral? I don't see anyone here in Las Vegas. Is there anyone online in neutral or on the phones?
If you would like to testify in neutral for AB 24, please press star 9 to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you. So at this time, I will, do you have any final statements? Okay, we're waving that. I see that waving through. At this time, I will close the bill hearing on Assembly Bill 24, and I will open the bill hearing on Assembly Bill 136. I do see Ms. Jacobs back in the room, and I believe she has a co-presenter. Are they online or in Las Vegas? And if she is, who, I don't know, I can't see that far.
Vice Chair Wynn, this is Joanna Jacob, Clark County Government Affairs Manager. With me in Grant Sawyer today is Jill Moreno, our Director of the Department of Family Services down in Clark County. So she is here to just give me technical assist if there are any questions on this bill, which is Assembly Bill 136. So coming out of the interim Health and Human Services Committee, excuse me. I apologize, I was in another hearing, so I ran over here. So very pleased to be here to present this bill. So I'll go ahead and just really tell you why we are proposing this bill, which is we had submitted this request to the Joint Committee last summer to proposing to update Nevada statutes to align with guidance that we had received from the Federal Children's Bureau on the implementation of the 2018 Families First Prevention Services Act. That was the broad omnibus bill that had updated foster care several years ago and had shifted the model for foster care to focus more on prevention services and evidence-based trauma-informed care. The primary goals of that bill were to build community capacity and to reduce the unnecessary use of congregate care in foster care. And in furtherance of that goal, there was a program, or I guess a service, that was defined as a qualified residential treatment program for children. And then we have been getting federal guidelines on this implementation, which has been a major lift for states and counties around the nation. And this guidance has said that foster care group homes are no longer reimbursable under the federal funding source 4E unless the home is a family-based setting, except under very limited circumstances when agencies may use this QRTP model for placement. It was actually, the guidelines said that because it was intended to reduce congregate care, it really cuts off the ability to use that federal funding source beyond 14 days unless you use this evidence-based model. And that is why, and the guidance has also told us that they must be licensed literally as a child care institution under a federal definition. That definition says serving I guess with placement up to 25 children. So we have been working with the state and with Washoe County, and that's where you see the language proposed before you in Section 1 of AB 136, which we are taking our state definition of child care institution, and we are adding the reference to the qualified residential treatment program. You see we have basically incorporated the federal definition. Regardless of the number of children who receive care and shelter, that is because the existing definition of institution, you can see right there in subsection A, was really limited to 16 or more children. So we are actually, Clark County is really looking at trying to do smaller models under this QRTP model, that we can do smaller group homes with fewer than 16 kids, really, though the federal definition says up to 25. And so that's why we worked together with Washoe County and with the state on this approach, consensus approach, I guess, on how the state would like to see this done, and so that they would be able to work with us on this licensing. And the purpose of the licensing is just so that we can bill for the federal funding, which helps to support foster care. So that's the intent of the bill. I'll keep it pretty short there, and Jill Moreno is there. She has been working on this implementation and on this plan if the committee has any questions, so we'd be happy to stand for questions right now. Thank you.
I have a couple of questions. So in the new qualified residential treatment program is defined in 42 USC. That is just so we are eligible to qualify for those funds with that expanded definition. Is that correct?
Yes, Joanna Jacob, for the record, that is correct. Vice Chair Wynn, it's basically the federal program of guidance that we got from the Children's Bureau has said, they've issued and said, we want to see the QRTPs licensed by the state agency that licenses childcare institutions. And so we, instead of going in, we actually had thought about trying to modify the definition and change the number, and then that would make a larger change to the other types of facilities licensed as childcare institutions in the state. So we just we chose to, I guess, add language there. And that is the intent, is that we can move towards implementing this model, which is federal law right now, and we can then bill for federal funding to support that care.
Okay, and then my second question has to do with that section 1. I guess, let's see, it's number 2, subsection B, where it's changed from who have been diagnosed to just with an emotional disturbance. What was the basis again for that, like, change to remove that diagnosis portion?
Joanna Jacob, for the record, Clark County. This was actually something that came out in the drafting, and I had a feeling that I might get a question on this, so I actually looked this up right before the hearing, and it is because that section, that NRS, and I presume maybe Ms. Cooper or Mr. Robbins is not here, legal counsel, but 433B 045 was actually updated in 2013 and so the statute actually refers to children with an emotional disturbance now instead of who have been diagnosed as severely emotionally. So there's Mr. Robbins. It is actually a cleanup, and if I'm misspeaking, he can probably tell me.
Go ahead, Mr. Robbins.
Yes, Eric Robbins, LCB Legal. Yeah, Joanna is correct. It's just because the term was changed in the reference statute, so we updated the term here.
Do we have other questions from committee members? Go ahead, Senator Titus.
Thank you, and I appreciate you jumping in here and being able to present, and Johnny on the spot. I need some clarification. So currently in statute, the residential facilities for children with an emotional disturbance per federal guidelines are 16 or more.
Joanna Jacob, for the record. Okay, let me try and clarify this. The current definition of child care institution under our law, licensed by HCQC in our state.
Right.
It is a type of licensure, and you can see that the existing language said 16 or more children. This is at line 5 or 6.
Right.
The federal definition said up to 25 children. And that is the definition that we're incorporating this with reference to 42 USC 672K for. That is actually the cite to the Families First section, which talks about QRTPs and limits the federal reimbursement for it unless it's a QRTP. So we put in language regardless of the number, because we're incorporating the federal definition there, and so that we can provide for smaller homes instead of changing the licensure that I believe, and I will have to defer to the state, but I believe this license has been used for like daycare facilities and other types of childcare institutions, and we didn't want to make a larger change that might impact those facilities, but instead allow for a second category under that definition, which will bring us into alignment with the federal guidelines that we're getting.
So is there any blurring of this for those places that have 16 to 25? What could they choose how they want to be licensed? Is there a different fee?
Joanna Jacob, for the record, I might have to phone a friend on the fee, because we're going to provide for this licensure. Should this bill pass, we'll be working with the state on creating this license type. So yes, we would pick how we would be. I'll give you an example, because it's actually a real-time example down in Clark County, and Ms. Moreno can correct me too, or I'll ask her to pitch in if there's anything we want to talk about what we're trying to do in Clark County. We are using one of we have been leasing one of the state buildings, the Oasis Cottages. For several months now. It provides for beds for up to 6 children. So that's the point, is that if we had, the existing definition says childcare institution is more than 16. The federal definition gave us some flexibility that we could do smaller settings, and there is actually, even to make it even more complicated, and I'm saying it like that because this is a heavy lift, is that there is an issue on Medicaid reimbursement, right? If we have more than 16 beds, then we're running into the IMD exclusion that I know you're probably familiar with. And so that's why we're trying to transition to smaller facilities. So this would allow us we would choose then the option under QRTP if we had a provider who wanted to be licensed, and we would then license that smaller facility for 6 beds. This provides for a path for us to do that. Ms. Moreno, I don't know if you have anything else that might address Senator Titus's question.
Jill Morano, for the record, Director of Family Services, Marano. And yeah, as far as the Qualified Residential Treatment Program goes and what Clark County's plan is, there aren't any fees associated with the actual license or certification for that. Now, I'm not sure when the state licenses childcare institutions whether or not they charge a fee, but internal to Clark County and sort of how we would envision this working is, as Ms. Jacobs stated, we have a 6-bed facility in Las Vegas. Because it's a staffed facility, it doesn't qualify as a foster care home, because a foster home has to have parents in it. So this would be a staffed facility. They would work through us with a licensing process or maybe a certification process to make sure that they meet all the federal requirements of a qualified residential treatment program. The responsibility for making sure that they meet those QRTP requirements, we would still plan to address on the child welfare side of the house, because it's a child welfare program primarily. So a program that, say, wanted to open maybe 17 or 18 beds and wasn't going to be a QRTP, might be something like a training school or something like that, that would be handled outside of the QRTP process.
And that's where I was going really with the question, is that okay, so that's where I was going with the question, because number one, I understand that Clark County doesn't have a fee, but this is going to be a Nevada statute, so you're affecting statewide facilities, and wondering if the state will have a fee for licensure, and how will the state define, do they get to choose whether they want to be the QRTP program, meaning that they're going to have up to 25 kids, or will the state say, no, you have more than 16, so this is a license, and if there's a different fee? This bill doesn't really define that. And so I think it's pretty okay, I understand that Clark County has this figured out how they will handle it, but this is going to be direction for this state, and just wondering, I need a little bit more clarification.
Joanna Jacob, for the record, from Clark County, and we have been working with the state because you're right. We will have this provides for the ability for the state licensure, which we need for the federal reimbursement. And in my discussion with the state, I guess I don't want to speak for the state, but in my discussion with the state on this bill, it is contemplated that likely there may be some regulation. That is because the HCQC regs, the facility regs, that are promulgated under the Board of Health or by HCQC, they usually set the standards for the licensure and then propose the fee in regulation. And I guess I would defer. I have a state partner here with me if that question would be addressed to her. I don't know if we have gone that far in the process, because we're providing the umbrella under NRS, and then we're going to continue to work with the state on the implementation at the state level.
I'm sorry. Is there a different rate of reimbursement depending on which one of the two, from a federal, is there a different rate for reimbursement?
Joanna Jacob, for the record, I can't speak to rates of reimbursement for the existing childcare institutions. We are trying to work with the state Medicaid division as well on this QRTP model. And with the state DCFS, the state has a policy on this, and we're working with both of those agencies on that. Ms. Moreno has been involved in those discussions, and I guess can maybe speak to that issue.
Jill Morano, for the record, the way that the 4E reimbursement would work is it's based on a penetration rate as determined by each of the child welfare agencies. So those are typically around, say, 40%. So how it would work would be something like if we charge $100, if the fee, maybe we're going to reimburse at $100 a day in our contract, we'd be able to bill back to the feds for like a 40% if that's what our penetration rate is. And most of the time, I think across the state, our penetration rates in child welfare are typically somewhere from 35 to 55% on the high end of what we're getting back from the feds.
Mr. Robbins, did you want to provide an explanation, or?
I can answer the fee question. I can't really speak about Medicaid reimbursement rates, but since these facilities are being licensed by the state, they would be subject to state fees. And under basically the way it works is under existing law, if you qualify as or if you're there are kind of two types of facilities. There are child care facilities, which are what we were talking about earlier with the daycare and things like that. And then there are child care institutions, which are what you see defined here in 432A0245 under existing law. And the child care facilities that are not child care institutions, they have to be licensed by either the state or a local government. And the child care institutions, in contrast, have to be licensed by the state. And so, because these would be child care institutions, they would be subject to state licensing. And it looks like the fee currently established under existing regulations for a facility under 25 kids would be it's $20 to $100 depending on the size of the facility.
Thank you.
Yeah, just again, the reason I'm asking these rather intently, it's just been recently brought to my attention that in my district there was just a residential behavioral health for youth in Hawthorne that is in jeopardy with the kids there. And I'm just wondering about, again, these kind of state laws brought by good intention, Clark County may be affecting. So there's 2 residential housing for kids that are not in compliance, and apparently one in Amargosa Valley that's being shut down, and a behavioral health residential house for kids in Hawthorne that I just found about yesterday that's in jeopardy of being shut down. And so all of this sounds great, but I'm just wondering, process of registration and licensure that we're doing today that Clark County may have organized, understand what's going on, impacts the rest of the state. And so I'm just wondering where the state is on this.
Joanna Jacob for the record, and I don't see anybody from DCFS here, but I will phone Ms. Finney here, who was involved with us in this, and you are correct. I guess as she's stepping up to the table, I'll tell you, we did try to work with Washoe County and the state, because just as a reminder, Washoe County, we have foster care under the block grant. Washoe and Clark administer their programs, but then DCFS handles the foster care for all the kids who are not in Washoe and Clark. So we tried to get all the child welfare agencies together, that's Washoe, Clark, and the state, on this approach, so that we made sure, even though this isn't something that we're trying to do in isolation just for Clark County, because we know it impacts our kids statewide. So we did invite the state to the table, and I'll hand it over to Ms. Finney to see if she can address the question.
Cody Finney, for the record. Deputy Administrator for the Division of Public and Behavioral Health Regulatory and Planning section. So perhaps it's helpful if I clarify that the facilities to which Senator Doñate, Chair Doñate, through you to Senator Titus, perhaps it's helpful if I clarify the facilities that Senator Titus is speaking of are currently licensed as psychiatric residential treatment facilities. It's my understanding that this QRTP, as part of the childcare institutions, would add an additional choice for services in Nevada and an additional funding source for services in Nevada for youth. The facilities to which you're referring are licensed, as I said, as psychiatric residential treatment facilities. We do have that as a specific license type, and I'd be happy if it's helpful to provide more information to the committee about those differences and similarities.
Great, thank you. When we can follow up afterwards, I just triggered my questions because of the B that you're changing with an emotional disturbance, and now clarifying that they're different license, and again, there's yet another license under this same kind of umbrella. So thank you for all the questions. But I have more after this.
Eric, Mr. Robbins, did you want to say something?
Yeah, I just wanted to follow up. I was looking at the definition of qualified residential treatment program under federal law, and it's a pretty specific definition. Like, I think that a facility has to be aiming to be a qualified residential treatment program and meet very specific federal requirements. So to the extent that there's a concern that this would like suck in other types of facilities accidentally, because the federal definition is so specific, I don't think that is likely.
Sounds good. Thank you, Eric. Mr. Robbins. Any other questions? Seeing none, we'll go ahead to testimony for this bill. If there's anyone in support, please come forward for AB 136. Seeing none, anyone in Las Vegas, and anyone virtually?
If you would like to testify in support of AB 136, please press *9 or raise hand in Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Anyone willing to testify in opposition, please come forward. Anyone in Las Vegas, and anyone virtually?
If you would like to testify in opposition to AB 136, please press *9 or raise hand within Zoom to take your place in the queue. There are no callers choosing to testify at this time, Chair.
Thank you so much. And anyone willing to testify neutral, please come forward. Anyone in Las Vegas, and anyone virtually?
If you would like to testify in neutral for AB 136, please press *9 or raise hand within Zoom to take your place in the queue. Chair, there are no callers choosing to testify at this time.
Thank you so much. Ms. Jacob, did you have closing remarks? Nope, you're good. All right. I'll go ahead and close the hearing on this bill. And that can, the final bill that we'll hear is Senate Bill 445. So I'll go ahead and open the hearing on this bill. This bill revises provisions governing emergency medical services. And so we will call our folks to come forward, and please begin when you're ready.
Thank you very much, Chair Doñate and committee members. I'll try to speak more slowly this time. My name is Cody Finney, and I serve as the Deputy Administrator of the Division of Public and Behavioral Health Planning and Regulatory section. With me today, I have Kitty DeSocio, ASO4, with the division to provide any technical budget information, and we'd like to thank you for your attention and time this afternoon on Senate Bill 445. So a brief description, the Emergency Medical Services Program manages the state's certification and licensure of EMS staff and vehicles, arranges grant-funded equipment and other regulatory activities for pre-hospital medical services. These activities are supported using an information system that we call ImageTrend, and that system includes all the license management, a license management component with all of that material, and a patient record component that allows us to report redacted data to national data collection regarding pre-hospital emergency services. Historically, the system has been funded with a variety of sources, including federal grants. And we are finding it increasingly difficult to identify federal funding to support the system. The program is also partially fee-funded, and these fees have typically been set to prevent undue burden to some of the smaller agencies that provide these services, which is why it's only partially fee-funded. In our efforts to ensure that we're using the available funding most efficiently, we requested this bill to allow the fees that we do collect to be kept in reserve and used for the purpose of supporting the system rather than reverting those funds each biennium. We're very happy to answer any questions about the purpose of this bill. We think it will improve our ability to effectively manage the program, and we thank you very much for the opportunity.
Thank you so much. Questions? Senator Titus.
Thank you. Question, so what % of the budget is general funds versus fee collection? Because I have concerns that if you're using general fund money for the program, it should revert back to the general fund if you don't use them all. You're looking at keeping the revenue from such fees, but you're also supported from the general fund, so I need some clarification.
Thank you. I appreciate the question, and we had long discussions about this internally as well. I want to go on record as saying we are absolutely committed to doing this right. We want to make sure that we are doing this right. I'm going to let Kitty DeSocio speak to the percentages, but your point is well taken. We want to make sure that we're doing this appropriately and that we're spending all of these fees appropriately, and I hear what you're saying, but I'm going to let the money people clarify exactly how that works.
So, Kitty DeSocio, for the record, Chair Dante, through you to the senator. It's approximately for 23, 24, and 24, 25, about 3/4 of the budget, the general fund. Do you want to know the fees section, or?
So no, so 3/4 of your funds are actually from the general fund. So 1/4 are supported by fees. And these fees are collected by the individual EMS services who use these, the system to do their uploading of the runs, or where are you collecting fees?
The fees are paid by the services that are inspected and licensure fees.
And the licensure fees are from the different EMS ambulance services that you license,
and the individual
correct?
staff people, the individual licensed service providers.
EMS folks, correct? Okay.
Yes.
And so this doesn't raise the fees, change the fees, which is why this is not a 2/3 bill.
Cody Finney, for the record, Senator Iñate, through you to Senator Titus. Correct.
Thank you so much. Any other questions? Seeing none, we'll go ahead and close the presentation and we'll turn it over for support testimony. So if you have support testimony for this bill, please come forward. We don't see anyone here in Carson City. Anyone in Las Vegas that would like to provide testimony and support? And BPS, anyone virtually?
If you would like to testify in support of SB 445, please press *9 or raise hand within Zoom to take your place in the queue. Caller, you are unmuted and may begin.
Hello, Chris McCann, again, Chief of EMS and Elko County Ambulance Service. I wanted to speak in support of this bill, SB 445. The software which they're talking about has been very beneficial to the program. The EMS program has been working to find efficiencies to try and be more proactive for us as providers, and the software that they're using has been something that has found a lot of efficiencies. I wholeheartedly support some more funding or the fees being used for that. Elko County Ambulance does pay those fees, both as permit, and we also pay for our providers. So those fees are sent to the office, and we appreciate knowing that it's going to a good purpose in the software for the licensing and for those purposes.
Chair, there are no additional callers at this time.
Thank you so much. Anyone in opposition to this bill, please come forward. Anyone Las Vegas, and anyone virtually.
Thank you, Chair. There are no callers choosing to testify at this time.
And last but not least, anyone willing to testify in neutral in Carson City, Las Vegas, and virtually.
Thank you, Chair. There are no callers choosing to testify in neutral at this time.
Thank you so much. Any closing remarks? All right, that closes the hearing for this bill, and we move on now to the last agenda item, which is public comment. Is there anyone that would like to provide public comment at this time? Anyone in Las Vegas? And BPS, anyone virtually?
If you would like to provide public comment, please press *9 or raise hand within Zoom to take your place in the queue. Chair, the lines are open and working, but there are no callers for public comment at this time.
Thank you so much. Seeing no public comment, we will go ahead and close today's meeting, and we'll see everyone next Tuesday. Meeting's adjourned.